So we've gone through a whole lot of other agenda items, and hopefully you've learned a lot in this process. It's been exciting for me to teach it to you or share my experience with you. Now I want to get into a surgical solution that can actually repair a disc that hasn't been able to recover, self-heal, or improve through these other non-surgical treatments that we've been talking about. Now, those are always our first go-tos because you can't uncross the bridge of surgery, but if you do get surgery, you need to make sure you're having the right surgery. So, if your disc is not getting better, and if you are still suffering from pain related to your disc replacement surgery might be the solution. Now, traditionally, any surgery related to the disc ended up in fusion or something like that. And as you know, if you listen to my other videos and watch them, you'll know that there's a lot of bad that comes along with fusion. Disc replacement is a technology that's been around for over 30 years now. It's a little less common in the United States than in some other countries like Europe, Germany, and Australia. I've looked outside the country, found mentors, and found the top surgeons in those countries that are doing high volume disc replacement. I've spent time operating with them in their theaters, in their countries, and I've learned a great deal. I've brought all of that back to the United States. There are a lot of patients, if you've been looking around for disc replacement, you'll find that there are actually surgeons in these other countries that will offer you to come to their country and have a disc replacement because you might not be able to get it here, or you might not be able to find a surgeon that is proficient, experienced, and skilled and committed to the technology. So if you're looking for someone in the United States that's doing high volume disc replacement, they're here. I'm one of them. So when you have a failed disc, when that outer fabric of the disc has failed, whether you've had a herniation to the disc, whether you've had a nerve impingement or undergone a microdiscectomy or prior surgery, a laminectomy, you still may be a candidate for disc replacement. In fact, I can tell you that some of my most successful patients are patients that have already gone through a microdiscectomy for leg pain and then subsequently end up having persistent or progressive collapse of the disc, and that ends up causing them disc-related back pain. Those are great candidates. Those are some of the patients that can do the best, where we can actually fix the leg pain for good and fix the back pain and avoid putting in rods and screws and fixating and removing motion. So disc replacement's great because it reduces your risk of ever having to have another surgery. The results are really great in the lumbar spine, but they're even better in my experience in the cervical spine, which is the neck. We're doing, in my practice, probably somewhere between 3 to 6 levels of cervical disc replacement every week. We're probably doing 1 to 2 levels of lumbar every week. That's pretty common in my practice now, and so the numbers of patients that we're treating and the experience that we have in taking care of patients like you that are looking for motion sparing technology to avoid fusion surgery, our experience is just growing more and more and more and more. I have a lot to tell you about disc replacement, but what I want you to know first and foremost is the primary reason to pursue or consider disc replacement is if your pain is related to a disc problem, you can have improvement with this therapy. I believe, my personal belief is that most of the problems in the spine, be it the neck or the back, are related to the disc. Now there are 2 other joints at each level in the spine. The facet joints, they're in the neck and the back, there's one on either side. They can be sources of pain, but my experience is that is less common. So when the disc has failed and you can't fix it, your body can't fix it, or chiropractic, physical therapy, medications, anti-inflammatory, regenerative medicine, when it's not working and you're tired of that, disc replacement might be the right solution for you. I'd be happy to talk to you about it. You can watch some of my other videos on disc replacement where I get into the nuts and bolts of how the device works, why it is a great solution, when it's indicated for neck or back indication, and when it's not indicated. So there are some nuances to it. I will say that the early indications for disc replacement are extremely strict. I've been able to find more and more opportunities for patients to benefit from this technology, and felt more and more comfortable offering it to my patients as my experience has grown. I hope this has been helpful, and I look forward to teaching you more about disc replacement in coming videos. Thanks, have a great day.